Hi, I'm Danielle Matias here at Caring Medical Florida, and I want to share with you an update on a previous patient that I had filmed about with her SI or sacroiliac joint pain. Spoiler alert, the patient's doing very well. This is a picture of where the SI joints are. Okay, so this is the pubis. We kind of wrap around towards the low back where your sacrum and your ilium, people call it your hip bone, meet. That is called your sacroiliac joint. You have one on each side of your body, right and left, and these can be pretty big pain generators if chronically injured. This patient that I saw for SI joint pain and instability and dysfunction was a 51-year-old female. And she described to me the way that her pelvis felt, where she said, on one side, I feel like my pelvis is doing this. It's like jazz hands. And on the other side, it's doing this. It's like parade princess. And I honestly don't think I'll ever forget that, because I thought that was such a great way to describe, in her own words, what her pelvis was doing on each side. These are stills from her motion x-ray done in February of 2024. So in a motion x-ray, what we had the patient do was do rotational views to see how far or how wide those sacroiliac joints were opening. And I really don't want to see them open up more than 4 millimeters. Anything more than 4 millimeters is instability where I'm concerned. So on her initial x-ray, look at this, 8 millimeters that joint opened up on the right, 6.3 on the left. So again, we've got jazz hands, parade princess, per the patient's words. Treatments are usually every 4 to 6 weeks. So after several treatments, we re-x-rayed to help see, how are we progressing? The patient's doing better. Do we see that it's actually tightening up on x-ray? And it is, right? So again, look, so we went from 8 and 6 millimeters, give or take, to 4.3 and 3.8. I mean, this is huge. Less than 4 millimeters, pretty stable. Almost there, just over 4 millimeters. That's a really big improvement. So just kind of side by side for each side. So from 8 millimeters of instability to 4.3. And again, on the other side, from 6.3 to 3.8. So this just really shows how useful these motion x-rays are for us to help determine, yes, joints are getting more stable. As the patient is moving, we can see that the joints aren't moving as much and they're becoming more and more stable. This is just a graphic. I'm a visual person. I like images that shows this. These are the SI joints here and all of this white. So these are all connective tissues that are supposed to help tighten and hold that SI joint together. So if you think of them like rubber bands, if they're tight rubber bands, you're going to have a stable joint. If those rubber bands get stretched out, maybe not to the point that they break or rupture, but they're stretched out to the point where they're floppy, they're not going to come back to normal tightness. That's what can happen with these ligaments. They just get stretched out and loose, and then your pelvis becomes unstable. Kind of some key points to take away from this patient's case. Really, like the dynamic imaging, that motion x-ray is very, very helpful to us to help diagnose issues and monitor progress. I use it a lot. Prolotherapy was appropriate and successful in this patient at tightening and strengthening the loose ligaments in her SI joints. And it is possible to successfully get rid of your chronic pain. It is possible to graduate from prolotherapy when you have stable joints and are doing very well.